silent and lethal like a killer hidden in the shadows. An invisible threat that can live inside us for years without giving any sign of its presence. We are talking about an aneurysm, a pathological dilation of a blood vessel capable of progressively weakening its wall until it causes its rupture, even causing death. But what is an aneurysm? How does it develop? What are the main risk factors, and how to prevent it? Let's find out together. The term aneurysm indicates an abnormal and permanent dilation of the arterial or venous wall, which causes the vessel to reach a diameter of at least double the normal one. This forms a sort of swelling similar to a small ball, due to a weakening and loss of elasticity of the affected vascular tract. Although many aneurysms can remain stable for years without causing any noticeable symptoms, in some cases they can suddenly rupture, causing internal bleeding. This is an emergency that requires immediate medical attention, and depending on the location and size of the aneurysm, it can be fatal. Aneurysms can occur anywhere in the circulatory system, but they most commonly develop in the blood vessels of the brain, or the aorta, the main artery that carries blood from the heart to the rest of the body. The formation of an aneurysm is a multifactorial process influenced by a combination of genetic and environmental factors. Among the most common risk factors in adults is hypertension, a clinical condition characterized by high blood pressure in the arteries. If left untreated, over time, high blood pressure can cause the formation of microlesions on the arterial walls, leading to a progressive weakening of the blood vessels, and thus favoring the formation of aneurysms. Not only that, according to the results of some studies, high blood pressure can contribute directly or indirectly to the rupture of the aneurysm with potentially fatal consequences. Another of the most common risk factors for the formation of aneurysms is atherosclerosis, a chronic and progressive condition characterized by the accumulation of atherosclerotic plaques on the walls of medium and large-sized arteries. These are deposits of fat, cholesterol, calcium, and other substances, which over time weaken the arterial walls, favoring the abnormal dilation of the vessels and therefore the formation of an aneurysm. Cigarette smoking, alcohol abuse, and drug use are other important risk factors for the development and rupture of aneurysms, as well as other fatal vascular events. This is because they increase blood pressure and accelerate the process of atherosclerosis, as well as reducing the elasticity of the arterial walls and promoting an inflammatory state of the same. Drinking excessive amounts of alcohol and being a smoker thus increases the risk of developing or rupturing a cerebral aneurysm, pathological dilation of a cerebral artery. As the Italian National Institute of Health reminds us, to reduce the risk of an aneurysm, it is important to keep blood vessels healthy and clean. To do this, it is important to start with what we eat, adopting a balanced diet, low in saturated fats and trans fats. The former can be found especially in the fatty parts of meat and derivatives, in butter and fatty cheese, in fried foods and cured meats, such as sausages and hot dogs, but also in some vegetable oils, such as coconut oil and palm oil. Among the foods rich in trans fats, we find spreadable creams and packaged snacks, but also fast food, French fries, cakes, and packaged biscuits. To reduce the risk of aneurysm formation, it is also important to monitor blood pressure, with particular attention to hypertension. A multi-center study of over 3,000 people with high blood pressure and cerebral aneurysms found that the use of antihypertensive drugs reduced the risk of aneurysm rupture by 18%. Quitting smoking and abstaining from alcohol consumption can also significantly reduce the risk of aneurysm development and rupture. Not only will this reduce the stress on the arterial walls, but there will also be an overall improvement in vascular health, with a reduced risk of myocardial infarction and stroke. In the case of an already diagnosed aneurysm, depending on its size and the area in which it is located, it is important to undergo regular checkups to monitor its evolution. In some cases, the doctor may recommend surgical or endovascular treatment, while in others, a conservative approach may be sufficient based on the intake of antihypertensive drugs and a change in lifestyle.